Welcome everyone to today's webinar, Finding Additional Freight Savings to Lower the Overall Cost of Care. I am Malia Papola with Becker's Hospital Review. Thank you for joining us virtually today, and we hope that everyone is staying healthy and safe. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Today's presentation will start out with insights from two presenters from the OptiFreight Logistics team. Brad Wilson is a Vice President at OptiFreight Logistics. Brad has 30 years of experience in healthcare distribution, manufacturing, and supply chain sales leadership. Much of his experience has been in the medical, ambulatory, laboratory, and pharmacy care arenas, working with clinical, operational, logistical, and sales teams that support a wide spectrum of innovative supply chain activities. For the past 6 years, Brad has led the commercial team for OptiFreight Logistics, including the medical acute and several non-acute markets. Ashley Dewhurst is a strategic account manager at OptiFreight Logistics for the Western region. Ashley has 12+ years of experience working in the healthcare industry. She has held various roles in sales and field service, specializing in medical distribution, supply chain, and freight management. In her current role with OptiFreight Logistics, she supports several large, acute strategic accounts that span across the country. Her primary focus is to partner closely with healthcare systems to help optimize and reduce their overall transportation spend. It is now my pleasure to turn the floor over to Brad to begin today's webinar.
Thanks, Aaliyah, and hello everyone. Thanks for joining us today. There's a pretty good chance that your health system is changing from a constant flow of mergers and acquisitions to expansion, and certainly the relentless drive to move care to just as effective but lower cost settings like inpatient to outpatient. And with all of those location changes comes more complexity and an even greater challenge to manage overall costs. Yet the mandate in healthcare really hasn't changed. It's still to save money, and that pressure will continue for sure. One proven way to help your health system meet its cost savings goals and define new and innovative ways to save is on shipping costs. And that's what we're really here to talk about today, is an overall transportation management strategy. And in particular, we're really honored today to have one of America's largest health systems, Banner Health, and Mike Halmrost, who's one of the senior supply chain folks there, talk about how they've evolved their freight management strategy to unlock new savings and efficiencies. So really today during this discussion and this webinar, we want to cover three things. First of all, we want to take some time to just address the public health crisis we're living through, COVID-19, and really what some of the learnings have been from us. I would say we've developed new muscles or strengthened muscles that we maybe haven't used as much relative to managing the complexities of international shipping, customs and brokerage navigation, and really responded in some ways I think that will make us better and stronger for the long term relative to new and innovative ways to help customers manage these business continuity challenges and the urgent need to get supplies and equipment to the right place at the right time. We're also going to spend some time again with Mike to learn from Banner Health about how they focus on strategy for transportation management and overall reduction of shipping savings. And finally, we'll go through some best practices where you can utilize these in your own health system, kind of start where you're at, so to speak, for your own freight management program. So before we get started, let me just tell you a little bit about OptiFreight Logistics and Cardinal Health and how we really believe we're uniquely qualified to help you take advantage of these opportunities today. So a little bit about OptiFreight Logistics. Again, as a part of Cardinal Health, we are uniquely positioned as we focus on logistics solutions to control and reduce costs across every modality of transportation. That's inbound, outbound, multiple carriers such as FedEx, UPS, DHL, regional carriers, large freight, which is freight that's greater than 150 pounds, same day, also known as courier, as well as mail consolidation. Really, the complete picture is what we focus on and what we go after, and we have the largest, most experienced team in the industry. We manage relationships with more than 7,000 suppliers and well more than 20 million shipments every year. 60% of the hospitals in the U.S. use OptiFreight Logistics from more than 22,000 different locations. And each year, we save our customers more than $530 million in shipping expenses. And we have a 90% customer satisfaction rate. We are ruthless with our efforts to ensure we stay in line and in touch with our customers. And we survey our customers, and we use that information that they provide back to us to drive innovation in our business and drive change and make adaptations. And really, as a part of Cardinal, who manages more than $1 billion in freight overall, we have a lot of learnings in context relative to not only how to move things, but what's being moved and how that fits in the context of your overall strategy for running your supply chain at your IDN. So just continuing on with that thought, here's a quick snapshot of some of the sites of care where we manage shipping today. And if you think about locations such as blood banks, surgery centers, especially laboratories and pharmacies, in addition to hospitals, but those first sites of care I mentioned, transportation is critical to the value proposition that those clinical services and support services provide and deliver, whether it's getting medication to a patient's home, managing round-trip specimen cycles, getting critical blood to where it needs to go in a certain amount of time, and certainly managing the complexity of everything that happens in the hospital setting and the integrated delivery network, and not to leave out home health, where, again, opportunities to deliver product and supply chain effectiveness at lower cost sites. So all of this is in the ecosystem and continuum of care that we look at. So again, as a part of Cardinal Health, we can provide proven solutions that are unique but address the specific objectives and strategies needed to make the supply chain successful in each of these areas. So to accomplish that, we've continued to evolve our freight management solutions to keep pace with the growing complexity that we've been talking about within health systems. So let's talk for a minute about history. Freight management used to be historically focused just on freight that came in from suppliers in small parcel format, so less than 150 pounds or greater than 150 that came in on a larger truck. But that was really the inbound play. And as we've talked about the need to evolve a holistic transportation management strategy, we now have proven solutions across all modes of transportation, which again is really how you want to look at effectively driving a strategy, is holistically across all transportation needs. So you'll see here we look at not just traditional small parcel and large freight, but we'll talk about international, we'll talk about same day or courier, regional parcel carrier, different types of unique needs where care is being delivered, whether it's inbound, outbound, to all the different sites, including specimen transport, medication delivery, all those type things. But we work with many carriers such as FedEx, UPS, DHL, and a variety of couriers and regional parcel carriers across the country to serve regions all over the U.S. and in Canada. And so before we take time to talk further about freight management, I really do want to address for a minute what we're all dealing with right now in terms of the public health crisis and living through COVID-19. So let me just take a minute to address this unprecedented time that we're living in right now. I've been in healthcare for more than 30 years and have seen a lot of different crises evolve, both on the supplier and provider, payer side, et cetera. I don't think it's a far reach to say that This is the most unprecedented time that most all of us have ever lived through. And just to give an example, I've talked to, just in the last several days, 6 senior executives from hospitals that are running supply chains, and almost to a person, I think each of those individuals and many of you on the phone are on your 35th or 40th continuous day of work. And I can't say it enough. We in the supplier community can't thank you enough for everything that you are doing throughout this process to support the frontline healthcare workers that are delivering care. And so the past 6 weeks, we've learned a lot of things, and I want to share a few of those with you today. Our dedicated team that is very close and intimate with our customers has been doing a lot of things that maybe are new and unique, but to support the shipping and logistics needs that have arisen out of this public health crisis. So again, at the end of the day, those in supply chain can deliver products at the right place and right time to support those frontline healthcare workers that are really helping us plow through this crisis. So just to get a better understanding of how we've helped our customers through this crisis in regards to freight management, one of the things we did just in the last week was to survey our top 100 customers. As I mentioned earlier, we're ruthless with our surveying of customers and understanding needs and making adaptations from that. And here's a little bit about what we learned through that recent survey. There have been significant health system challenges through this public health crisis. And many of those do revolve around transportation and the expedited nature of that. But one of the things we learned, for instance, several of you have changed your inbound receiving practices, where you used to use a signature, or you used to have the driver from the carrier cross the threshold into your clinical departments or different parts of your hospital. Many of those changes have occurred where you've stopped those practices or had to make adaptations because of fear of contamination, et cetera. So one of the things that we do on a routine basis with a dedicated team from FedEx, which is one of our largest carriers, we have a routine connection point with them on a daily basis with their dedicated team for OptiFreight. And we've been able to connect many dots with them from health systems that have had some of these changes to communicate back into their operations how to adapt to those so it doesn't affect the smooth and efficient flow of deliveries during this critical time. We've clearly seen an increased need for the demand and scheduling and tracking for large freight shipments expedited from international locations and imports of PPE. And I would tell you this absolutely includes supporting and navigating many of these complexities that none of us deal with on a regular basis. This includes things like how to charter an aircraft, how to navigate duties and customs brokerage, how do I work with a freight forwarder. That just names a few elements that we've been able to help and support customers with towards the mission of getting the product into the right place during this critical time. Plus, we've been helping to set up more shipments direct to patients' homes and alternate sites of care. So in cases where a patient may have come to the hospital to pick up a medication or to come in for a clinical trial, that needs to be delivered at the home. We've been able to become involved to deliver solutions to make that happen and help the customer with that mission. In some cases, we've also set up same-day solutions, and you'll hear about that a little bit later in our talk today, to help with the courier volume as health system needs are changing on a daily basis. So in a crisis like this, it really makes a difference who your strategic partners are, and I just would like to re-echo the fact that OptiFreight Logistics and Cardinal Health are well positioned to be that strategic partner, and I've been so impressed with our team as we've gone through this process. And today we're going to hear in a bit from Banner Health, again, one of the country's largest health systems, about how they look at freight management and how they've dealt with things through this crisis. But before I pass it over to Ashley, I do want to take a minute to just say thank you again to all of the supply professionals for your tireless dedication to supporting the caregivers on the front lines. Rightly so, those frontline caregivers are nurses, doctors, first responders, are getting a lot of accolades in the public eye and in the media. But the supply chain professionals that I know at times feel very frustrated about the challenges that you're facing today, we very much appreciate what you do, and the folks on the front line couldn't do what they do without you doing what you're doing so well. So again, on behalf of OptiFreight Logistics and Cardinal, thank you for all that you've done to help support getting us through this crisis. And at this point, I want to pass it over to my colleague Ashley so she can share more about our collaboration with Banner Health.
Of course, thanks, Brad. Banner Health is a valued partner of OptiFreight Logistics and have been on our program since 2015. They are headquartered in Phoenix, Arizona, and are one of the largest nonprofit healthcare systems in the country. The system owns and operates 28 hospitals, including 3 academic medical centers. Banner also has a growing network of health centers and clinics across 6 states, totaling more than 400 locations. Their workforce is made up of over 10,000 physicians and 30,000 nurses, in addition to other clinicians and staff. So based on those numbers I just shared, you can imagine how significant Banner's shipping needs and shipping spend can be. That's why the goal at Banner Health is to find additional freight savings to lower the overall cost of care. In a few minutes, we'll hear directly from the Senior Director of Contracting at Banner Health, and he'll share the role that freight management plays in supporting Banner Health's system-wide goal of lowering the overall cost of patient care. There are multiple strategies that Banner Health is using right now to lower their freight costs, and we'll be covering these in more depth today. We'll be sharing more about their goals to reduce their overall cost across the health system, how they manage and monitor their inbound freight spend from suppliers, as well as their outbound shipments being shipped from their facilities. You'll also learn more about Banner's self-distribution model and how it helps them centralize freight spend in order to lower and limit their freight costs, as well as the critical role that data and analytics play to reveal new opportunities to save. And finally, you'll see how Banner Health's collaboration with OptiFreight Logistics is inspiring the innovation that drives freight costs down. In order to maximize those savings, Banner Health and most health systems, for that matter, need to overcome a critical challenge. Brad, can you talk us through the challenges that health systems face when it comes to driving down shipping costs?
Sure can, Ashley, thanks. The challenge has to do, as I mentioned earlier, with just the continued expansion of health systems like Banner. As these systems become more complex, add more locations, more states, deliver more services, so does freight management. The key to remember here is that freight is implicated in every type of move, whether it's, again, a service change or a location change that happens within a health system. So, again, this is an industry-wide challenge. It's not just at Banner, but it drives home the need for a comprehensive, holistic freight management strategy. It's absolutely urgent because as the growing complexity of health systems increases, so increase inefficiency and costs. So here's some key industry trends that are worthwhile to call out that kind of emphasize this financial urgency. So there was a study that HIDA did about a year and a half ago of hospitals and health systems that basically indicated reducing operating costs was one of the key factors that were critical to their success. In fact, 65% of the survey respondents said that reducing operating costs was the top challenge that they faced in the year 2018. And in fact, financial challenges were 3 of the top 4 that were cited in the survey. Other challenges included managing reimbursements and meeting budget targets. No surprise there. So where does this growing complexity actually come from? As you'll see here, and as we've mentioned already today, healthcare consolidation is the origin of this growing complexity, and the consolidation just continues to increase. So consider that 68% of hospitals and health systems have growth plans that either involve expansion of services, acquisitions, and that's all according to the HIDA survey that I referenced earlier. Again, what's driving this growth? It's the addition of physician offices, lower cost sites of care, clinics, And really, that was, one of the leading elements or element areas within the merger and activity that was cited. So think of the ways that healthcare consolidation is complicating shipping needs. So, for example, mergers and acquisitions at record speed. We've had a number just in the last 18 months that we can all name from, the continental U.S. There's a huge shift, and we've seen even more of it in the COVID crisis here of, how do we get to different sites of care, so from inpatient to outpatient. The addition of more and different types of procedures, changing diagnostics, et cetera, and of course, those other sites of care such as ambulatory surgery centers, pharmacies, laboratories, blood banks, home health, and so on. So let's take a closer look at the impact that all of this complexity has on shipping practices today. So what you're seeing here is a representation of how complexity grows with decentralized transportation. Think of each of these columns as a department or division or function within a health network. There's 5 represented here. These are 5 common areas, but we see typical large integrated delivery networks with as many as 30 of these vertical columns. So departments such as lab or pharmacy, supply chain, home care, they all have different things that need to be shipped inbound or outbound or moved around within the network. Each of these departments or functions has different transportation needs to help ensure that those items arrive, where they need to be, when they need to be there, and at the appropriate cost. So what happens when all these departments act independently? They create a lot of inefficiency is what happens, and there's lost opportunities to save money. So you'll see each of the unique areas that these experience and have in the top portion of the slide. On the bottom, you'll see some of the very common elements that weave across those. But many times decisions aren't made in a enterprise-wide or a forward-looking across the whole spectrum. They're made in these silos, and that's where inefficiencies and increased costs occur. And Banner Health recognized this problem and decided to take a different path. And again, we're going to hear a little bit more about that in a few minutes. So take a look now, same slide, but notice how much simpler it looks. It's the snapshot of the decentralized spend that I showed you on the last slide, but in a centralized model, the departments can focus more on what needs to be shipped versus how to ship it. So the model takes care of ensuring that items are delivered on time and at the appropriate cost. So a centralized transportation strategy may not be the most effective strategy for every health system, but that's where OptiFreight Logistics comes in to be able to provide further guidance and support for your health system to make a more informed decision around different tools and strategies that you can use to manage transportation holistically across your system. So for health systems that would benefit from a centralized freight management strategy, there's 3 steps that we recommend, and we'll peel each of these back just briefly. The first is to create visibility across your entire freight spend. By centralizing this and leveraging data and analytics, which are absolutely critical, you open visibility into how you're actually spending money on freight today. And that allows you to identify opportunities to save without negatively impacting the timing of delivery. The second big element is to gain control over every shipment. And there's that old saying, you can't manage what you can't see, you can't control it, and if you have visibility to it, it allows you to make different type of decisions with a high level of confidence. So once you gain that full visibility from the first step, then you can make decisions to improve efficiency and even down to tracking while in transit, which is critical in certain types of clinical operations and departments to know where packages are at intra-shipment. And thirdly, you can optimize transportation mix that will allow you to improve both efficiency and savings. You'll have the knowledge that you need to optimize transportation, both modes, and better allocate resources. And we can't stress this enough these three steps work in concert together to drive the strategy. So let's turn our attention now to the OptiFreight Logistics services that Banner Health is actually using today. And for that, I'll pass it over to Ashley.
Well, as you can see on this slide here, Banner Health works with OptiFreight Logistics to manage freight and lower costs in 4 key ways. One way is with inbound shipping. Currently, we have about 1,000 suppliers in compliance with the program, meaning that they use the appropriate FedEx account number and shipping instructions when they ship, so that Banner Health can take advantage of their discounted OptiFreight rates. We're continually adding and partnering with new suppliers as well, while also working to ensure that all of those on the program are staying compliant. On the outbound side, Banner Health staff members ship about 250,000 small parcels each year. Through our OptiFreight Logistics website, Banner shippers can prepare labels for their outgoing packages and optimize those by selecting the most cost-efficient mode. Our website is designed to really guide our shippers to the most cost-effective way to ship, while also providing estimated days and times their packages will deliver by. Banner also has a significant amount of large freight shipments on both the inbound and outbound side. We see about 2,000 shipments each year that are shipped LTL, meaning less than a full truckload. The freight charges on these shipments are often overlooked as a part of a comprehensive freight program, and they can really add up. So large freight is a key part of Banner Health program. Lastly, they are one of our newest customers utilizing OptiFreight same-day solutions. Same-day courier services are the most complex freight management challenge, and the cost can be double the amount of small parcel and large freight costs combined. As I mentioned before, this is the newest of our services that Banner Health has added. Not only is it saving them money, it's closing a critical gap in the service that the COVID-19 crisis revealed. So we'll tell you more about that in a moment. The services we just reviewed are key components of Banner Health's freight management program, but the most important part is the collaboration that transforms these services into new innovations that create significant savings. The OptiFreight Logistics team and I deeply engage with Banner Health at all levels, from leadership down to the individual shippers at the facility. It's an integrated, hands-on approach with one goal: to share ideas and bring new savings initiatives to life. We base our recommendations on decades of industry leadership with the aim of driving continuous innovation and improvement. Let's touch a bit on data and analytics and why it provides value to Banner Health. Data and analytics play an important part in managing freight for various reasons. It increases spend transparency. Banner Health is constantly monitoring overall performance and trends across their health system and comparing individual sites' metrics through benchmarking. They also use it to find new opportunities to save. Their supply chain team is committed to driving more compliance from their suppliers in order to fully manage their freight. It also provides them with visibility to shippers both on the inbound and outbound side that could use mode optimization to reduce any unnecessary expedited shipping costs and fees. So throughout it all, the key is customization. In developing tools and reporting that truly help Banner be able to track their savings performance and identify ways to be more efficient in their supply chain. We'll now introduce Mike Halmroth with Banner Health, and he'll share more about their comprehensive approach to freight management and how they partner with OptiFreight Logistics to reduce their cost to ship. Mike Halmroth is the Senior Director of Contracting at Banner Health. He is focused on supply chain management and cost savings opportunities within the system. Mike has 24 years of experience in the healthcare supply chain in healthcare supply chain sourcing, procurement, purchasing, and contracting. Mike, will you share a little bit more about Banner and provide your perspective and insight on the topics Brad and I just covered?
Hello everyone, my name is Mike Halmrest. I'm the Senior Director of Contracting for Banner Health. As Ashley mentioned a few minutes ago, Banner is a very large health system. We're based in Phoenix, Arizona. In fact, we're one of the nation's largest nonprofit health systems. We have more than 400 locations in 6 different states, various types of care facilities. Every one of those facilities has various unique shipping needs. So we are a very complex system, and from a freight management perspective, we're getting more complex all the time. You might say we're in a state of constant change because of things such as new initiatives, acquisitions and mergers of various clinics, other hospitals, etc. New locations, either through new builds or acquisitions as well. Ongoing supplier changes with regards to suppliers we're utilizing for various supplies, and new contacts and consultants, and capital investments and technology changes all are things that we are in the midst of undergoing. So what are we specifically doing at Banner Health to drive freight costs down? What best practices are we following ourselves to manage our transportation spend more effectively across our entire health system? Let me touch on 5 key points that help guide our strategic direction for freight management. Some or all of these points may be helpful to you as you develop your own freight management strategy for your hospital or health system. The first key point that drives our freight management strategy is that at Banner Health, we have a system-wide goal of lowering the overall cost of patient care. In fact, you might say that we have a culture of savings at Banner Health, and that every staff member is continually looking for new opportunities to save money. Because we are predisposed to lower costs as a culture, our staff members react positively when presented with hard evidence that a new savings strategy works. A great example of this is our freight management strategy, which is built from the ground up to constantly increase our savings. I'll tell you more about what we do that is just in a minute. But for now, I'd just like you to know that Banner Health has a great success in actively lowering our shipping costs while maintaining or improving the level of service we provide to every location across our system. As a result, we are making significant contributions to Banner's strategic goal of lowering the overall cost of care. We're freeing up dollars that can be directed to supporting quality patient outcomes. At the same time, we're helping to improve physician and staff satisfaction by giving them more resources to take care of patients. What are some of the key ways that we're using freight management to free up more dollars for patient care? Let me touch on 2 strategies in particular. The first is reducing the cost per package, and the second is managing more freight spend in our health system. Next, we'll dig a little bit deeper into each of those. To begin with, reducing our cost per package is the bottom line focus of our freight management strategy. We set a specific target cost per package. Then the OptiFreight Logistics team works on-site with us to continuously analyze our shipping data and look for new ways to meet or exceed that goal. As an example, there are opportunities to shift from expedited to lower cost ground shipments without impacting the date the delivery of that product is needed. Data analytics also help us monitor individual sites to determine to what extent they're meeting our cost per package goals. If the data reveals that a particular site is falling behind our goal, we can work with them to develop a plan for improvement. As I mentioned, we have a culture of savings at Banner Health. So if we present a credible case for how to lower costs, our staff members are open to those ideas. We also use data analytics to work with our suppliers to ensure they're utilizing the program everywhere possible. And that brings us to the second key freight strategy, managing spend within our system. The more inbound, outbound, and large freight shipments under management, the more dollars we save and free up for patient care. It's that simple. So from an inbound shipping perspective, we make sure Banner's central purchasing team has the information to help drive compliance with our suppliers. From an outbound shipping standpoint, the OptiFreight Logistics web portal provides shipping advice for mode optimization, so our internal stakeholders know which mode is most cost-effective for getting the package where it needs to be in the time frame needed. And as Ashley mentioned earlier in this presentation, the web portal also makes it easy to centralize and gain visibility into shipping activity. Plus, the portal generates custom reports that help us track our performance and spot ways that we can improve. In addition to focusing on cost per package and managing more freight spend, we're looking at additional cost-saving strategies as well, such as including same-day courier services under the broader umbrella of total transportation management. You may ask, what is total transportation management? It's a strategy where every shipping delivery service that you use across your hospital or health system is all managed under a single umbrella. Data analytics consolidate all of your shipping information and history into a single platform that you can review for opportunities to save system-wide. A first step towards transportation management is centralizing freight spend, which is the third key point of Banner's freight management approach. One aspect of Banner Health that is rather unique is we have our own warehouse distribution center. We have the built-in ability to centralize our freight spend through that mechanism. It helps bring value in driving costs down in that particular perspective. Imagine having individual inbound shipments being delivered to hundreds of facilities daily. Think about how those shipments could really add up. We have, and there's a built-in solution at Banner Health to help bring those costs down. We're looking at centralizing all of that inbound freight into our warehouse where it makes sense. We would then deliver those shipments ourselves to our individual facilities, thus saving or even eliminating shipping charges. That is where our collaboration with OptiFreight Logistics comes into play. They work in our best interest to identify more ways for us to centralize spend at our warehouse and deliver out to our individual facilities. OptiFreight is always looking for what's best for Banner. For example, we've had a few suppliers who weren't compliant with our program in the past, but now we have them shipped to our warehouse and then we make the final delivery out to our individual facilities. These suppliers cover the cost of those large shipments into our warehouse because there are efficiencies that they can gain by doing those large shipments instead of individual smaller shipments. This is a perfect example of how we're eliminating freight charges together working through the OptiFreight Logistics team. The fourth point of Banner Health's freight management approach is one we touched on a minute ago. At Banner, we rely heavily on data and analytics to help us find new opportunities to save. Data and analytics are essential to driving continuous improvement. From a freight management perspective, what has evolved the most for us over the years is our access to quality data that helps us make informed decisions. Without that data, it's difficult to see the opportunities otherwise. OptiFreight Logistics brings data insights to us so we can make more informed actions. Many of those data insights come to us via the OptiFreight Logistics online dashboard. We also receive raw data from OptiFreight that we feed into the Banner data warehouse. From there, we create our own Tableau reports as well. They give us visibility into shipping trends over time and help us compare our performance with our established goals. So from a data analytics perspective, it has been a good collaboration with OptiFreight Logistics. especially in getting our supply chain teams at individuals' facilities to engage with the data and monitor their own performance. For example, our supply chain folks work closely with our cath lab and perioperative teams, which traditionally have high volume of expedited freight. One goal is to look for ways to convert more shipments from expedited to ground service without disrupting the quality of patient care. Another area we rely heavily on data and analytics is managing more of our large freight. It gives us more visibility into our total spend, which is of course vital in helping us lower freight costs overall and contribute to our system goal of lowering the cost of care to our patients. Earlier in this presentation, both Brad and Ashley commented on the fifth key point of Banner's freight management approach, and that's having a close collaboration with OptiFreight Logistics. That is really the key engine that drives innovation, because together we're continually discovering new ways to drive our freight costs down. It is truly a team effort, as OptiFreight Logistics works with Banner Health at all levels, including our facilities, our supply chain operations at those facilities, our centralized purchasing team that I previously mentioned, as well as our contract administration team and other executives within Banner Health. It's safe to say that OptiFreight Logistics is our standard for freight management and how to address the growing complexity of our health system. As we add new facilities, we ingrain OptiFreight into our processes to help save on freight costs from day one. We even include our corporate offices in the program where there is a lot of outbound shipping. It's all about moving toward total transportation management at Banner Health, as I mentioned earlier. It should be the goal of any health system that's ready to maximize its freight savings. For a health system ready to make the commitment, I would recommend that you assign an internal champion with time to devote to lowering freight costs. Use data and analytics to benchmark your performance and continually improve your results. And work with a freight management company with the expertise and resources, such as OptiFreight Logistics, to help turn your strategy into action. I believe that you'll see the results in your bottom line, just as we here at Banner Health have.
Thank you, Mike, for sharing your insights into the success of Banner Health's freight management program. For those listening in, you'll want to ask yourself, what are the specific freight management goals that you might want to set for your own health system? There's not really a one-size-fits-all approach, and your health system may be able to take advantage of some or even all of the following strategies that Banner has put in place. But these are just a few of their strategic goals that support the effort to reduce their overall freight spend. Increasing their managed spend is a top priority for Banner Health, and they focus on which suppliers are shipping the most outside of the OptiFreight program and try to understand who is profiting from freight by shipping prepaid and ad, meaning the supplier is adding a fee or a line for the freight to the customer invoice and profiting from that amount charged. Another goal is to optimize the modes of transportation and services that are being used on the inbound side from suppliers, as well as the outbound side from their facilities. Banner asks itself, what can we ship ground versus overnight to lower the cost per package? And whose behavior can we change to become more cost efficient and drive more savings? They also have the goal to ship more product large freight. In Banner Health's case, having its own warehouse distribution center means that the health system generates a significant amount of large freight and has the ability to purchase in bulk. But really, any health system can benefit from managing large freight through its freight management program. A good question to ask yourself would be, what are some of the action plans that your own health system can put into place to achieve these strategic goals? Brad, let's go ahead and take a look at some of the goals and objectives that Banner has put in place.
Thanks, Ashley. And before we begin to review these, let's keep in mind that not all the action plans we're going to discuss here would be relevant for every health system, and that's where having the right freight management partner and OptiFreight Logistics can help you determine which action plans would be the best fit for you. Remember, a strategy is made up of a whole bunch of tactical action plans, and we're going to talk through here 4 of the most common focus points that we've seen health systems employ to get the biggest benefit from. So the first objective is really increasing the total spend managed, the total freight spend managed. So you want to get as much under management as possible, because the more you manage, the more you have visibility, the more you have control, and ultimately it presents opportunities to drive savings. So Ashley, you tell us a little bit more about some of the details within increasing managed spends.
Yeah, and Brad, one of the proven ways to manage more freight is to identify those suppliers who represent the highest inbound volume that is not being shipped through your freight management program. Then work on providing those suppliers with the appropriate shipping instructions and guidance to use your freight management program. You'll also want to collaborate with a supplier in your freight management team long-term to ensure there is continuous compliance. There are also specific tools and methodologies that we use at OptiFreight Logistics to drive compliance. As we touched on earlier, data and analytics are key as well and play a big role in setting unmanaged supplier spend goals.
Thanks, Ashley. Let's talk about the next major objective, and that is taking advantage of a website that can help you drive program savings across a variety of stakeholders. Just take a second to think about how many employees can actually touch shipping decisions inside a large integrated delivery network. It could be hundreds, thousands, or even tens of thousands of folks that have the ability to make shipping decisions that ultimately might not be the most cost-effective or efficient manner from that standpoint. The website and the OptiFreight Logistics website allows you to drive optimization by touching all of those users and staff members, for instance, to give them the most cost-effective decision support at the point of decision to ensure that packages arrive where they're supposed to and on time and in the most effective manner. A lot of our customers are seeing the value in managing more outbound shipping via our website. And again, especially if you've got new employees or you're asking employees to follow a new procedure, there's always training involved. And our website's a fantastic resource for that. Just several new training videos, think of a YouTube video that educate folks on shipping. So if you're a current customer, log in and take a look. It could absolutely help you with your training progress and process. And it's an easy way to drive compliance across those stakeholders. So Ashley, again, if you can comment a little bit more about how we put this action plan into place, that would be great.
Yeah, I'd say to put this plan into action, the goal is to convert as many of your outbound shippers to the OptiFreight Logistics shipping website. The more individuals who comply and take advantage of the tools and guidance it provides, the greater your savings will be. Using a website such as ours is also an easy way to control and provide visibility to your system shipping activity. You can also use the various reports our website offers to target additional ways to save.
Thanks, Ashley. So we've talked about increasing managed spend. We've talked about utilization of website to reach stakeholders. Let's move on to the next major objective, which is how do you improve compliance? So that is an extremely important goal towards a comprehensive, holistic transportation management strategy. The more parties and constituents that are in the transportation ecosystem with whom you can drive compliance, the greater opportunity you have to drive spend reductions, greater efficiency, and overall value. So, what can you do to improve both inbound and outbound compliance across all your stakeholders? That includes suppliers, separate facilities within your system, individual departments, and the shippers that work within them. And Ashley, again, give us some more details about this particular objective and the actions we could take.
A good way to quantify your goals and measure your progress over time is by setting specific measurable targets for expedited services such as overnight and 2-day shipping. Then you'll want to communicate those goals to stakeholders and share how their shipping behavior, both on the inbound and outbound side, can impact the health system's total freight costs. You'll want to work with them alongside your OptiFreight team by educating them on best shipping practices. Each health system works differently, and our experienced team understands this and knows how to work collaboratively with individual sites across your health system.
Thanks, Ashley. So we've talked about a variety of specific objectives and action plans: increasing your spend, use of the website, improving compliance. Here's a big one that's very common, and it's a great opportunity to drive and improve efficiency. So let's drill down a little bit more specifically around how do you increase inbound and outbound ground shipments. So this is a significant opportunity to drive savings. The difference between an express shipment that's coming into your health system and a ground shipment could be 100, 200, 300% difference. A package coming in that would come in express by 10:30 in the morning might cost $80, and that same package arriving on the same day but a few hours later might cost $30 coming in via ground. It's an easy switch to make, but you've got to have the visibility, you've got to have tactics in place and controls to drive this. So many times a non-educated user within your system just selects the overnight option automatically. But again, you really got to ask yourself, and this is common sense, is it always necessary? Does that package really need to be here by 10:30 in the morning, or if it arrived later that same day, does that enable me to still deliver the care and achieve my objectives, but at a substantially reduced cost? So those are questions that we help to make more visible for you and help to drive better behavior with the end users and the constituents. So if you just think about that one example, and large systems that have hundreds of locations and thousands of shippers affecting freight costs, think about the savings you could drive with that on every package every day. And again, Ashley, tell us a little bit more about some specifics about how you'd put this into place.
Yeah, I'd say to really achieve this objective, you'll want to start by setting a measurable goal for your ground and expedited services, as Banner Health has done. Then assess the individual site's knowledge about the program and give them a solid understanding of their role in saving the organization money. You'll want to make sure they are armed with actionable data to be able to support the changes they enforce within their facility. You'll also want to monitor the performance of your individual sites and work with them to close the gap on achieving those service mode goals. Again, data and analytics are key to monitoring performance.
Thanks, Ashley. I appreciate the opportunity to review those 4 example objectives that could be a part of your freight management holistic strategy. But here's the other side that we're not spending a lot of time talking about today, but we absolutely must touch on it, and that is courier or same-day services. Again, those words are oftentimes used interchangeably, but this is point-to-point delivery that's occurring in the same day within your system. This is arguably, hands down, the most complex transportation challenge that health systems have today. Even those that are on top of their game with a well-designed system can very quickly become littered with new couriers that create duplication and waste and inefficiency. Again, if you go back to our earlier part of the discussion when we looked at different functional areas or clinical areas within a health system, each of those have unique needs, and many times each of those departments are making their own decisions around same day. It really creates an opportunity where you can have duplication and waste that's occurred. And typically, this cost in this particular space for same day or courier can be literally double the amount of what is being spent on small parcel. So a health system that may spend $500,000 on small parcel shipments inbound and outbound very easily could be spending $1 million on courier services. As we've talked about today, those successful health systems are employing holistic transportation management strategies to include both same day and parcel as a part of their overall strategy. So we work very closely to try to solve these issues and to provide visibility and control to not only look at parcel or large freight, but also same day and courier opportunities as well. And you'll see several of the things we've talked about here on the slide relative to opportunities that you can uncover. This is how you can make even urgent deliveries very routinely cost effective. And Ashley, tell us a little bit more about the Banner situation. As you mentioned, this is a recent service that they've taken advantage of.
As we touched on earlier, OptiFreight Same-Day Solutions is the newest freight management service that Banner Health uses and has helped address potential supply risks due to the COVID-19 pandemic. The health system needed additional courier resources to service its rural Arizona facilities, and Banner needed that additional support to ensure that it had after hours and weekend coverage, just 24/7 for urgent PPE needs. Banner Health and OptiFreight Logistics worked closely together to get a contract in place and services up and running very quickly. And this is just one way OptiFreight Logistics Same-Day Solutions can help your health system. Our service can really be tailored to fit your needs. And I know we just touched on this briefly today, so please feel free to contact us if you want to learn more or just have any questions about your same-day needs.
Thanks, Ashley. And as we close up, we've been through a lot of freight management best practices today. So first of all, I want to say thanks to Mike Halmross from Banner for sharing how Banner is using these practices to drive down shipping costs and evolving their transportation holistic strategy for management and driving effectiveness. To sum it all up, there's several steps that we've talked about that health systems can take right now to save on shipping. And again, I want to emphasize that holistic transportation management is a strategy, and you need to pick pieces and parts of this that work for you. Some of those that we've talked about today: increasing freight spend under management, use of data and analytics to reveal new savings, and certainly improve freight management program compliance with all of the constituents with whom you deal. So thanks to Banner. Thanks to everyone for attending today. I want to reemphasize my thanks that I mentioned early on. Thank you to all those supply chain professionals that are out there for all that you are doing in this huge time of unprecedented crisis we're living through to support everybody on the front lines. Again, I know this has been a frustrating time and a challenging time, but it's also a great time to recognize the organizations that come together and the folks like yourselves and your teams that are delivering every day to make sure that healthcare is delivered as effectively as possible to help us through this very challenging time. So again, thanks very much for all that you're doing. Aaliyah, I'm going to turn it back to you real quick. I think we might have a couple of questions if we've got a few minutes here.
Thank you, Ashley, Brad, and Mike, for that fantastic presentation. As we are at the end of the hour, that is all the time we have for today. We did receive a number of great questions that we will be responding to following the webinar today. With that, I'll ask Brad to share any final thoughts to close out today's webinar.
Thanks, Aaliyah. I'll just close up real quickly here with a couple things. First of all, thanks for attending today. We appreciate your time and attention and your questions. Thanks to Mike Halmross from Banner for his insights about how Banner is developing and using their freight management strategy in conjunction with OptiFreight Logistics. And most importantly, thank you for all of you in the healthcare supply chain and all the work that you're putting in right now to get us through this public health crisis. If you have a minute, please take that to complete the survey that we've given to each of you. Your feedback is really invaluable in helping us continually improve how we can better deliver on what we do and how we evolve it in discussions like this one. So thanks a lot and have a great day.